Good afternoon. My name is Rich Collins. I'm the Emergency Services Director for Sarasota County, and joining me today is Chuck Henry, our Health Officer and Director for the local State of Florida Department of Health in Sarasota County. Chuck, thank you for joining me today.
Thanks for having me, Rich.
So Chuck, today we're going to kind of do a quick update on the numbers of where we're at with registrations and how that's going. So why don't we talk about how many doses and how you're working this week?
So this week we received an allotment of 3,300 doses from the state. Those are already planned out. In fact, appointments already went out for vaccine clinics on Tuesday and Wednesday for that 3,300 doses. We actually released 3,600 appointments because we had 300 remaining from last week. And I want to talk about that a minute because on Friday's clinic, we had about 300 no-shows for scheduled appointments. And that creates a big issue for us because we want to get the vaccine into arms. So we're asking people, if they get an appointment, please, and they're not going to come, please decline that appointment when you get it. Or if you're already got the vaccine somewhere else, go in and remove yourself from the list. You can do that in your Everbridge account. That will really help us out so that we don't end the day with extra doses that could have gone to someone's arms that needed them.
That's a really good point, Chuck, as we think about the number of people. I mean, it's very simple that somebody could have a doctor's appointment or somewhere else that they needed to go, but they need to let us know so that we can get it out to somebody else.
And in the system, you can decline an appointment because of those reasons, and you stay at the top of the list, and you'll get another appointment next time we have vaccine. So we're most concerned about those that give no response or they respond that they're coming and then don't show up, because we certainly plan for them to be there, have the vaccine for them, and then that vaccine doesn't get into an arm.
So we moved to the SRQ Mall, and we're out there working now. The site's going well. We've got a lot of great feedback from our citizens that have been out there and had vaccines at the site. And so let's talk a little bit about where we're at this week as it relates to account numbers. Now, for our citizens out there, if you remember, the account number is a specific number given to the account as the citizen registers. And that account number could include up to 2 people. And in fact, we're finding that about 40 to 50% of the registration accounts have 2 people attached. So why don't we talk a little bit about where we're at with the account number this week from that perspective, Chuck?
So that number, 6,299, is the update after we released the 3,800 appointments for Tuesday and Wednesday. We're currently looking at those that declined, those spots still open because of appointment declines. And we're probably going to try to backfill, so that number will change a little bit as the week goes on. But that's right about where we're at. It's important when you look at that number, not to look at like the 3,300 and just add that to, if that's what we got next week again, just add that to it. Because remember, as Rich pointed out, many accounts have 2 people in them. So that 3,300 may only move the needle 1,500, 1,600 account numbers. So it is helpful, though, to know where you're at, know what your account number is, and see where we're at in the mix.
So let's talk about that for a minute. Right now, we're showing about 115,981 accounts in the Everbridge system. Now, I think it's really important for our citizens to know that we have a lot of duplications. So somebody registered 4, 5, 6 times trying to get in, family members trying to get their mom and dad in. And so that number is a higher number because of those duplications. And then we have applications or accounts that were started and then just stopped and not finished. So that number shows 115,981. As we work through, that number will fluctuate going down as we find those duplicates and continue to move through them. So the number will move depending on that as well.
That's a great point, Rich. And everyone should understand that as we work through those duplications, if you're someone that had lots of family members trying to register in the system and you ended up with 5 or 6 accounts, as we identify those, we'll go ahead and eliminate the duplicate accounts, but we'll retain the account that has the lowest number, so you don't lose your place in line.
That's a really great point. And so as we continue to move forward, I think it's important to note, while we're at 6,299, that number is going to move, but it's going to move based on how many dual citizens we have in an account that's rolling through. And we're going to continue to move through this over the next several weeks. And as vaccine increases into the area, that will help us as well. And that's your biggest issue right now.
Right now, the biggest issue, as it has been since we started, is the amount of vaccine coming into our community. We're pleased to see over 3,000 doses a week because early on there were weeks we got 1,000 or less. So the 3,000 is a great improvement, but we'd like to see over 10,000 a week coming in. We, with the new mall facility, have the capacity to put out more than 10,000 doses a week if we were receiving them.
So that's a great point. So as we move forward, I think it's important for citizens to be watching our SarasotaCounty.gov page. If you go to the home page and you hit the purple banner at the top, that'll take you to the COVID-19 vaccine page. Everything vaccines on here. And you'll notice right here at the screen, it actually shows where we're at for the vaccine number, account numbers for this week. So I would check that regularly. If I'm 15, 18,000, I'm going to look back every week, and as we get closer to that, I'll know that I'm in the queue soon to get a potential call.
Absolutely.
So, Chuck, appreciate your time today. I know the team's working very hard. They're getting ready for tomorrow's first dose vaccines. We'll be doing that on Wednesday as well, and then Thursday we go to second dose, and Friday second dose as well, correct?
That's correct, and that's a good point. I'm glad you mentioned that. For anybody that received their first dose at the health department the first week of January, so January the 4th through the 8th, we're doing second doses for that group this Thursday and Friday morning at the Sarasota Square Mall. And everyone should receive an appointment for that today. Those appointments went out a short while ago. So if you didn't receive an appointment, then understand that you are due for your vaccine, and we still want you to get it. We have your vaccines, so you should try to come in on Thursday or Friday morning if you're due for that second dose vaccine. You'll need to download the consent form, because we need a consent form just like the first dose, and bring your cards if you have them, because that helps us move you through the system faster.
Chuck, I thank you for all of your time today and all the work of your team out at the site, providing vaccines to our residents and all that you're doing. With that, we'll end today. Have a great day. Stay safe.